Alright, so I'm going to record this one, just in case, and we'll record one tomorrow. We'll record. Then you can edit that. Yeah. It's all yours. I'll give us like 1 second. I'll send you. And this is, let me make sure this is on though. Testing, testing. Yep, it's on. They can see your screen. Yeah. All right. Good afternoon, everyone. How's everyone doing? You guys doing okay? Yeah. So ICD10 change is coming in a few days, October 1st, 2016. So they've put together. So what we've done is the coding education team has put together a summary of high specialty impact service lines. So OB-GYN, ophthalmology, musculoskeletal, and then we'll send everything out via email. So you'll have a hard deliverable NFL copy. So don't worry about writing everything down. And then if you haven't signed in, you can wait till to sign in at the end, and then see you in the back when you're done. So I'll turn it over to Lisa to start us off on musculoskeletal.
Okay, there's several changes in the musculoskeletal documentation. One of them on the neuropathy, such as like carpal tunnel syndrome, we now have bilateral and upper and lower. Used to it was just right and left. Other deformities of the foot, there was actually a new code for a bunion and a bunionette. So those are two new codes. This isn't on the Okay, TNJ is now right, left, and bilateral. So that's new. One of the biggest things, and especially in the spinal surgery, for your C-spine, instead of mid-level for C4 through C7, it's now broken down to C4 through C5, C5 through C6, and 363 through C7. So it's not just one code now, it's 3. There is documentation on here like with myelopathy, but that's from last year also, but I included it just so they know that, you know, we still got to document that. The femoral fractures, they have new descriptors. We have atypical, incomplete atypical, complete transverse, and complete oblique. Of course, we still do right, left, and your 7th digit characters. Those are not new, but they're still on there. Congenital metatarsus, you now have primus varus and abductus. Your skull fractures, the new part of that's going to be your right and left. You still have your 7th digit character. You also have to do the fracture specific type as 1, 2, or 3. For fractures for the maxil or the malar maxillary, so can we turn the light down? I can barely see this. Actually, I can read from here. I'm sorry. Okay, this is also a new laterality, right or left, the same 7-digit character. That also goes for the fracture of the mandible, the condylar process of the mandible, the subcondylar process of the mandible, the coronoid process of the mandible. All your mandible fractures, they have left and right now, where they used to, they did not. The dislocation of the jaw and the sprain of the jaw is also now right, left, and bilateral. That's new. If you can see in the bold, that's put under there what is new. The rest of that's still the same as last year, so you still have to do that. Make sure your doctor knows this. Fractures of the foot have right and left now, and this is a new code. Overexertion, these are new descriptors. It's not just one. You now have strenuous movement or load, prolonged static or awkward postures, repetitive movements, and unspecified strenuous movement or postures. Okay, your next, the Salter-Harris fractures are now by physial, calcaneus, metatarsal, and phalanx. You have to specify the type 1, 2, 3, or 4. It's still the same laterality and it's still the 7-digit codes. Your doctors will get training on this too, but we just want the coders to be aware that these are new codes coming out so we can watch and make sure that they're getting this too. Okay, the breakdown of mechanical implanted neurostimulators, these are all new neurostimulator codes, and they need a 7th-digit character. So all of these breakdown of mechanical are actually new codes in this section. There's new codes for observation and evaluation of newborn ruled out for suspected musculoskeletal condition or suspected connective tissue condition. There's a new code for arthroscopic surgical procedures converted to open. Activity choking game. Don't ask. Multifocal motor neuropathy is a new code. And they have some new perioprosthetic fractures around the internal prosthetic joint. The new part of this is going to be they're going to have to specify which joint, a hip, knee, ankle, shoulder, or elbow, the laterality, and the 7th-digit character. So that is your new updates for musculoskeletal. We will be sending out emails with attachments on this so you don't have to write all this down and remember it. And we will be talking to your physicians. For psychiatry, there's only 11 new codes, no new documentation. We have other specified depressive episodes, disruptive mood dysregulation disorder, other specified persistent mood disorder, mixed obsessional thoughts and acts, hoarding disorder, skin picking disorder, other obsessive compulsive disorder, binge eating disorder, other specified eating disorder, transsexualism, and social pragmatic communication disorder. That's the only changes in your psychiatry section. Okay, now we're going into neurology. And there are a few changes in neurology, mostly on new coding, not much so on the documentation. So we have a new code of post-procedural hematoma or seroma of the nervous system, organ, or structure. Bilateral cerebral infarct due to embolism, unspecified occlusion or stenosis, and thrombosis. There is now a new bilateral code for this. Still the same documentation, just a new bilateral code. For deficit following non-traumatic subarachnoid hemorrhage, non-traumatic intracerebral hemorrhage, other non-traumatic intracranial hemorrhage, cerebral infarction, or other cerebral vascular disease, and unspecified cerebral vascular disease, we now have to specify the type of deficit for your character, for your 6-digit character. These are the ones you can choose from: attention or concentration, memory, visuospatial, psychomotor, frontal lobe and executive function, congenitive social or emotional, other symptoms or signs involving cognitive functions, unspecified symptoms and signs involving cognitive functions. Okay, your new part on the NIHSS score, your stroke scale, is now that you have to specify 0 through 42. So there's one for 0, 1, 2, 3, all the way to 42. So that's what is new on that code. They've added a lot more for that. For your leakage of neurology system devices, implant or graft, that is a new code. Still requires a 7th-digit character. Other mechanical complications of neurology system device, implant or graft, that is a new code. Your Glasgow Coma Skill score are still the same, but they now have 7th character indications for evaluation time location. This is all new. So you have unspecified time in the field, which is an EMT or an ambulance, at the arrival to emergency department, at hospital admission, or 4 to 24 hours or more after hospital admission. In your infection and inflammatory reaction due to ventricular intracranial communicating shunt, that is a new code and requires a 7th digit. Infection and inflammatory reaction due to implanted electronic neurostimulator is a new code. You have a 6th digit of brain for the electrode lead, spinal cord electrode lead, and generator. And it still requires a 7th digit. So there's a lot of new codes for a neurostimulator. That's the majority of this section that has changed. We have infection and inflammatory reaction due to cranial spinal infusion catheter. That's a new code with 7 digits. Infection and inflammatory reaction due to other neurology system device or implant or graft. That's a new code. Embolism due to neurology system prosthetic devices, implants, and grafts, a new code. Fibrosis due to neurology system prosthetic devices, implants, and grafts, other internal prosthetic devices, implants, and grafts. This is new. Hemorrhage due to neurology system prosthetic devices, implants, and grafts, other internal prosthetic devices, implants, and grafts. Still requires a 7th digit, but that's a new code. Pain due to neurology system prosthetic devices, implants, and grafts, 7-digit code. Stenosis due to neurology system prosthetic devices, still need your 7th digit. These are all new codes that I'm going over. Thrombosis due to neurology system prosthetic devices. Other specified complications due to neurology system prosthetic devices. Unattended awareness under general anesthesia during a procedure. That's a new code. The last two is observation and evaluation of newborn or suspected neurological conditions ruled out, and aneurysm of other pre-cerebral arteries. So that's your changes, and we will send out handouts with the new codes and the new tip sheets. And I'm going to turn it over to Donnie to go over the next 3 chapters. Thank you.
Hello, I'm Donine Day. I'm the coding educator. I was a surgery coordinator for so long, it still takes a while for me not to say surgery coordinator. But I am the coding educator for otolaryngology, general surgery, urology, plastic surgery, oral surgery, and surgical oncology. And I am going to go over otolaryngology, dental, and genitourinary. Okay, this is the ear. When we think ENT, as far as the ear is concerned, we're not looking at just the outer ear or the part that goes up to the eardrum. A lot of times we're looking at the middle ear, which is all these little structures here, and the inner ear, which is that big part right there. So the ENT code updates are otology that I'm going to go over. So just to give you an idea of what the ear looks like. Okay, so the new codes for ENT. It used to be that we have codes for hearing loss. So hearing loss can be conductive, sensory neural, or mixed, which is a combination of conductive and sensory neural hearing loss. So previously the code said conductive hearing loss with unrestricted hearing in the contralateral ear. And if you know anything about hearing loss, most of the time hearing loss doesn't just occur in one ear, it occurs in the other ear also. And that being said, the hearing loss isn't going to be the same. So it really didn't make sense for the codes to say unrestricted in the other ear, because that's probably not the case. There's usually some restriction of the hearing in that other ear as well. So they have the conductive hearing loss, right ear, contralateral side, conductive hearing loss, left ear, sensory neural, right and left ear, mixed right and left ear, and those are all restricted now. So that means you have to use 2 codes because you have to specify what the hearing is in the other ear now if you use that restricted. And then there's a thing called tinnitus, and that's ringing in the ear. I'm sure y'all probably heard of tinnitus, where it's ringing in the ear. Some people describe it as humming in the ear. And previously, we just had the 1 code for tinnitus. Now we have, we can describe the tinnitus as being pulsatile. And what that is it sounds more like your heart is beating in your ear, like you can hear your pulse in your ear, as opposed to just your general ringing and stuff. We didn't have that option before. So, of course, we have the laterality, right and left, bilateral or unspecified. Then we have intraoperative and postoperative complications and disorders of the ear and mastoid process. The codes have been broken down. It used to be hematoma and hemorrhage in 1 code, in which hematoma and hemorrhage is a little bit different. You know, hemorrhages means you're bleeding, and hematoma is more like a bruise. So they've broken those codes out, and they've actually also added a code for seroma. So you have post-procedural hematoma of the ear following a procedure on the mastoid process, and then there's one for post-procedural hematoma following other procedure. And like I showed you on that picture, the first picture, the procedure may be on the mastoid process, but there's other parts of the ear that could be operated on. So the code specified that it doesn't necessarily have to be the mastoid process that the ear was operated on to have that complication. And so these are the codes for the hemorrhage. The other ones I just showed you were for the hematoma and the new one for seroma. And these are the old codes, but now they've been revised to just say hemorrhage instead of hemorrhage and hematoma. Okay, the next thing I'll talk about is that's ENT. Anybody have any questions about the hearing codes? There's also some respiratory stuff, but that falls under ENT, but somebody else will cover respiratory, so I'll let them have that. Okay, so now I'll talk about oral surgery. There's a thing called pulpitis, and that's an inflammation of the nerve and blood vessels in the tooth. This area here gets infected and inflamed. And they actually didn't have a code. The new code says it can be reversible or irreversible, and it was never described that way before. And this is what it winds up looking like when it comes through the tooth like that. Okay, so then we have our periodontitis codes. Those codes previously, they were aggressive and localized. Now they've broken them down into severity. So you have slight, moderate, or severe. And then you also had aggressive, generalized, and they've broken that down to slight, moderate, and severe. They also have codes, instead of aggressive, they also have chronic. And they've done the same thing with the chronic codes. It's localized with the severity now, or it's generalized with the severity now. This is a new code, horizontal alveolar bone loss. That's the bone loss that you get from like periodontitis disease and gingivitis that causes tooth loss. So they have a code now for that actual bone loss. Unsatisfactory restoration of tooth. They have all kind of codes for unsatisfactory restoration of teeth, but they did this particular one is for occlusal trauma, which is where they've had trauma to the teeth and it hasn't been repaired, and it hasn't been repaired or it hasn't been properly repaired, and they haven't had a code for that in the past. So now we have a code for that: primary occlusal trauma and secondary occlusal trauma. And then the fracture codes, and Lisa did cover these some, but these oral surgery does take care of mandible fractures, malar fractures, maxillary fractures, and zygomatic fractures. So they have now the laterality for those codes where they never had that before. Okay, and this is urology. I didn't do any pictures for that.
Thank you.
I didn't want to be the one presenting those pictures. They had some interesting ones, but I thought I'll leave those alone. So the term benign prostatic hyperplasia indicates a more specific enlargement of the prostate gland. The previous code is enlarged prostate without urinary tract symptoms. These are codes that urology uses a lot. They're heavy use, so this is going to be a significant impact for them. That code will change to benign prostatic hyperplasia without lower urinary tract symptoms. And then you have with lower urinary tract symptoms. Also, there's a code for other post-surgical erectile dysfunction. That'll change to other and unspecified post-procedural erectile dysfunction. This terminology distinguishes the enlargement from other causes of prostatic enlargement, like prostate cancer of the prostate gland, acute and chronic inflammation, and infection of the prostate gland, or prostatic abscess, just to name a few. But that terminology from the previous slide helps differentiate that condition from any of these. And then these are new codes. One prostatic code will be deleted and replaced by these codes. It was dysplasia of the prostate. Now it's going to say unspecified dysplasia of the prostate, which we know we want to stay away from if at all possible. Then we have prostatic intraepithelial neoplasia, atypical small acinar proliferation of the prostate, and other dysplasia of the prostate. So those codes are all replaced at N42.3, dysplasia of the prostate. So that's expanded quite a bit. And then this is the next code we're going to say goodbye to, N50.8, other specified disorders of the male genital organs. We have left and right testicular pain. Believe it or not, we didn't have those codes. Unspecified scrotal pain, other specified disorders of the male genital organs, erectile dysfunction following radiation therapy, erectile dysfunction following interstitial seed therapy, and erectile dysfunction following prostate ablative therapy. Other new codes, when the patient experiences an infection or inflammatory reaction due to catheters or devices, you'll be able to report more detailed diagnosis than ever before. There's infection and inflammatory reaction due to cystostomy catheter, an indwelling urethral catheter, and nephrostomy catheter, and the urinary catheter. So those codes will replace the infection of the urinary catheter alone. They've gotten real specified with exactly what type of device it is. And then you have implanted devices also have many reporting options. We never had these before for neural stimulation devices, urinary sphincter, ureteral stent, urinary stents, prosthetic device, implanted penile prosthesis, testicular prosthesis, and prosthetic device implant and graft. So I didn't want to show y'all any pictures. These were the ones I was looking at, but I looked at them and I said, nah, I'm not going to do that.
We didn't ever got that.
Okay, and so these two codes will be deleted as a result of having those other codes, infection and inflammatory reaction due to prosthetic device. See how that just says prosthetic device? And infection and inflammatory reaction due to prosthetic device, implant, and graft in the genital tract. One was the urinary tract, the other one's the genital tract. So that's it for me. Any questions, concerns? I tried to make it short and sweet and to the point. All right. You up next, Jenna? And Jenna's up next.
Hi everyone, I'm Jenna Evans. I'm the coding educator for the IM Specialties Pod, and I'm going to be talking a little bit this afternoon about endocrinology, gastroenterology, immunology, and respiratory. So we're going to kick it off with endocrinology, which has about 16 pages worth of changes this year, but I think we're going to be able to highlight this and try to narrow it down for you, because it really blows my mind with I-10. As much as we added in terms of laterality when it came out, they really missed some of the areas, like there was no laterality for ophthalmology. So you're going to see a lot of that affected with these diabetic codes today, and you'll probably hear a little bit more from Troy also, and hopefully between the two of us, we'll get all these taken care of for you. So as you can imagine, with the diabetic codes, you have a lot of diabetes that have the ophthalmic complications. So I want to specifically first talk about your categories. If you remember in I-10, that's your 3-digit code. So the E08, I'm going to see it, which is the diabetes mellitus due to underlying condition with diabetic retinopathy. Then the next one down here is the drug or chemical induced diabetes mellitus, which is the E09 category. And I'm going to go through these real quick. I'm going to go back and pull all this together for you. Then we have the E10 and the E11 categories, the diabetes type 1 and type 2. And then the other specified diabetes mellitus, which is E13. So how I want to pull all these together for you is if you look right here, see if I can get my finger to get this to scroll and get this where you can see it just a little bit, get it all on one. Good. Okay. So right here in this first column, you're going to see the one thing that pulls all of these together that you currently have for each of those that I read out, E08, E09, E10, E11, and E13, is for all of those currently in what you're coding today, you have the non-proliferative, and then you have to select mild, moderate, severe, and then with or without macular edema. Then for the proliferative, you have the with or without macular edema, with traction retinal detachment involving the macula, with traction retinal detachment not involving the macula, with combined tractional retinal detachment and rheumatogenous retinal detachment, or with stable proliferative diabetic retinopathy. So you can see there are a lot of combinations there that you can have for all of these. The only thing that's changing for each of those categories that I told you about, E08, E09, E10, E11, and E12, E13, I'm sorry, is that you're now going to have the capability to say, is it the left eye, the right eye, is it bilateral, or not specified. So nothing else with those has changed with the diabetes with the ophthalmic complications except actually putting in the eye that it affects. So it looks like a lot. It's a lot of changes on 16 pages, but by the time you narrow it down, that's really what your driving change is with each of those, okay? So just there are an actual few new codes that I do just want to highlight that they have added in, and you'll also see some themes as some of us go over some of these too. You'll see in each chapters they've tended to add in similar things. So for the endocrinology chapter, there's several new additions. Diabetes mellitus due to underlying conditions with diabetic macular edema resolved following treatment. So that's another little recurring theme I've seen in the book this year with things entered in resolved following treatment. So there's several here for the diabetes. There's this one right here. Then there's also one for drug or chemical-induced diabetes mellitus with diabetic macular edema resolved following treatment. So it actually really follows right along with each of those categories, the E08, E09. They've added this one in for each of those areas. Diabetes mellitus with macular edema resolved following treatment. So they're each of those. So that's on that one. Then a couple of other new things, and I think it was Deneen that mentioned, and perhaps even Lisa mentioned it too. Another area where we're seeing a lot of additions are the post-procedural types of things. So here, there's also a couple in this chapter. Post-procedural hematoma of an endocrine system organ or structure following an endocrine system procedure or other procedure. And a post-procedural seroma of an endocrine system organ following an endocrine system procedure or other procedure. So you'll see a recurring theme, like I said, in all the chapters. We're seeing a lot of those added in this time also with those post-procedurals. So believe it or not, that's the 16 pages of endocrinology in a nutshell. Any question on those before I move on to the next one? Okay. Zip over to respiratory really quickly. Yeah, no, I hit the wrong. Yeah, I'm going to. My fingers were just going in the wrong direction. So there's really not a lot in terms of respiratory. The first two you're going to see are very similar to what we just read before on the other chapters. They're the two post-procedural hematomas, and these have to do with respiratory systems, organs, or structures. So it can be following a respiratory system procedure or another procedure, and also the post-operative seroma following a respiratory procedure, an organ or system. Couple of new codes that do exist for this are diseases of the mediastinum, mediastinitis, and other diseases of the mediastinum not elsewhere classified. And then a thoracoscopic procedure, which is converted to an open procedure. That's another new theme I've seen in a lot of the codes. We're seeing codes added for things being converted to open or closed. And that's actually it for the respiratory section. They were nice and easy. So probably the other area that I have to cover that has several, but nothing like what we had in the endocrinology chapter. Mouse just does not want to act very nicely. So we actually see that they've added for the gastrointestinal stromal tumors that you actually have a way to specify a location now. Esophagus, stomach, small intestine, large intestine, rectum, other sites, and unspecified sites. So, and of course, as with a lot of the other codes we've seen, we really want to try to stay away from unspecified when we can. We also have food protein-induced enterocolitis syndrome and enteropathy. Some new codes for colitis that just break that down more specifically, so we have more specific types of codes. Actually, ischemia of the intestine, so you'd actually say, was it small, large, or was it not specified where the ischemia took place? And then actually be a little more specific, focal, diffuse, acute, each of those broken down to help us on those. Then, a few more in this column here. The necrotizing enterocolitis, we now can specify is it stage 1, 2, 3, or unspecified on that. Irritable bowel syndrome, be a little more specific. Is it with constipation? Is it mixed or other? And then constipation, was it drug-induced or is it chronic idiopathic constipation? So a few new codes, the one for the megacolon. Before it actually read megacolon not elsewhere classified. Now you can tell is it toxic or other. So we hope that they'll document that for us. Here with the acute pancreatitis, we actually had the idiopathic biliary alcohol-induced, drug-induced or acute currently, but now they're giving you the 3 bullets here underneath, the without necrosis or infection, with uninfected necrosis, and with infected necrosis. So that's what's actually new for that one. And then, like we've seen in the other sheets we've looked at, here's some new codes for post-procedural hematomas and seromas. And then one I'll call to your attention because it could be one I think we will see used a good bit if we happen to see a surgical procedure actually converted to an open procedure. And was it a laparoscopic procedure, or was it another procedure that was converted to an open procedure? Any questions on those? These are all. Well, this just says surgical procedure converted to open. Hang on, let me get my sheet here, Janine. Just a sec. I'm sorry, say that again. Right, so these are actually new this time. Yes. Thank you. Okay? Yeah, I don't know why they did away with those. And it's just like not having the left-right bilateral for the eyes. That made no sense, you know. So, okay, so the last one, this is a quick and easy page. Immunology really affects a lot of, the first section's mast cells, so these are more out of the neoplasm section, but they fell in the immunology section. So these are just some new codes up here. A little bit about mast cells, drilling it down, making it more specific. Then the other addition here is they've added a lot of Z codes. These are all Z codes that you have under the encounter for. Are they there for a prophylactic antivenin injection, prophylactic Rho immune globulin, prophylactic rabies immune globulin, prophylactic fluoride administration, Other specified prophylactic measures, and then prophylactic measures that perhaps they're just not telling us, and then a desensitization to allergens if you have allergies, and working on desensitization. And that's actually it for the immunology section. Any questions on those that I presented? Okay, great. And Teresa's headed this way, so I believe she must be next in the fun.
Hello, my name is Teresa Williams, co-educator for cardiovascular, thoracic, anesthesia, and transplant. But today I'm going to be going over cardiovascular, neoplasm, and lymphatic. Oh, earlier I handed out a pamphlet, and I think a lot of people got a little confused because they thought it was the first person that presented. But this is my packet, and this is how it looks. Okay. Let's see. Okay, what I do? Okay.
All the way to the top.
The top.
Keep going to your left. Go to your left. Go to your
Right.
left. Back to the right. The slideshow.
Right here?
Right up to the top. Right up here. Right here, slideshow.
Oh, okay.
No,
Right, I do it after the top.
Okay, so we all know that CMS allowed us like a 1-year grace period for unspecified codes. Well, that grace period has ended, and now the CMS will now expect for physicians to document and code with high levels of specificity for conditions that fall within their specialty. Although still allow the use of unspecified codes should be rare, and most unspecified codes should fall outside the physician's area of expertise. Okay, neoplasms only have 2 codes for 2017. I provided you the ICD10 code and the description of that code. Hormone sensitive and hormone resistant are the 2 new codes for neoplasm. Next is lymphatic. If I can turn the page. Lymphatic has 3 new codes. Castleman disease. Does anyone know what that is? Because I didn't. Castleman disease, and I wanted to kind of give you a description of Castleman disease. The other code is post-procedural hematoma of the spleen following a procedure on the spleen. The other is post-procedural hematoma for the spleen following other procedures. Castleman disease, I can even see. Castleman disease is a lymph node and related issues. It's also known as Castleman's disease, giant lymph node hypoplasia. Castleman disease is not cancer. Instead, it's an abnormal overgrowth of cells of the lymph system that is similar in many ways to lymphoma. Even though Castleman disease is not officially a cancer, one form of this disease is known to be very much like a lymphoma. In fact, many people with this disease eventually develop lymphoma. And with lymphoma, Castleman disease is often treated with chemotherapy and radiation therapy. This is why it is included in the American Cancer Society for Cancer Information. Thought maybe that's an interesting tidbit. My next area is cardiovascular, which is really my baby. And cardiovascular changes are basically coming from Chapter 9 and Chapter 19. And I also made some copies for everyone. It should be in your packet of Chapter 9 and Chapter 19 of some of the changes. Oh, I'm sorry. Why is this not so? Okay, hypertension is one of the changes. You know, in ICD-16, hypertension is basically I-10 through I-15. They have added a new category, I-16, and it basically covers hypertension urgency, emergency, and hypertension crisis. They're also added bilateral codes have been added to include separate codes for cerebral infarction due to thrombotic or embolic occlusions of vertebral, carotid, middle cerebral, anterior cerebral, posterior cerebrobelar arteries. Sequela of cerebral vascular disease codes from category I-69.01 through I-69.31 have been expanded to include several codes for specific deficits. For example, attention and concentration, memory, visual spatial, psychomotor, frontal lobe, and executive function, cognitive, social, and emotional, other specific and unspecific deficits. Precebral and vertebral artery aneurysms have been added to category I-72. And again, they're all in that little packet, Chapter 9 and Chapter 19. Category I-77.7 has been expanded to include separate codes for arterial dissection of unspecified, vertebral, or precebral upper extremity, lower extremity, and other specific arteries. There are a lot of intraoperative and postoperative hemorrhage and hematoma category codes. I-97 has been expanded to provide separate codes for hematoma, seroma, and hemorrhage. There are stable angina included under other angina, I-20.8, that's a new code. Therefore, should be reported with coronary artery disease with code I-25.118. Stasis dermatitis has been removed from under varicose vein with inflammation and is now listed under venous insufficiency, I-87.2. The codes that are changed in Chapter 19 have been added for stenosis of cardiovascular and peripheral stents in category T82.85, and it's a lot of those. New device complication codes, for example, device erosion, neurostimulator complications, and other neural devices have been added as well. New inclusion notes for category T85 codes, and there's a lot of those too. And I just wanted to add some additional tidbits for vascular. Chapter 11 has new codes in category K55 and K56 for vascular disorders of the intestines. Chapter 13 has expanded disc level descriptions. Chapter 14 has new category N99.5 codes for stomal incontinence. Chapter 21 has new codes to identify oral anti-diabetic drug use. Sorry. And I also just added to my little presentation some of the new codes. For example, cardiovascular hypercholesterolemia has now added a 6-digit. It is now E78.00, and familial hypercholesterolemia is a 6-digit, been added to that one too, and it's E78.01. The others are just all new codes. I know.
With rubber bands in your mouth.
I know, with rubber bands in my mouth. So and that's I just want, this is a repeat of what Chapter 9 and Chapter 19 has. Thank you. That's it for me. And I know a lot of you, this vascular is not everyone's subject. So in case you ever decide to want to transfer to a different specialty, this is some good information to have, vascular. Oh, Troy. Troy's coming up here. Uh-oh. A minute, how did she even come out of here? Okay, my name is Troy Thompson, and my areas are, I had to write them down.
Human genetics, radiation oncology, hematology oncology, ophthalmology, GYN, OB, and dermatology. So, some of my information is the same as everybody else has already presented. So what I want to say is, let's get down to the real nitty-gritty now. Y'all know I have to throw something crazy in there. You know, that's just how my personality works. So what I wanted to add to what everybody else was saying, that Medicare for all claims with date of service on or after October the 1st, 2016, you must use the updated ICD10 codes. If you do not, CMS will reject all claims using the old codes, and then you know we would be in trouble, right? Some commercial payers, some will take longer to update their codes, so we may have a little grace period, but that too could also result in claim denials and payment delays. So we want to make sure that we're as accurate as possible. No, we're not going to think that everybody's going to know everything at the same time all the time, but that's why we're here together and we can help one another. Most of the diagnosis coding for ophthalmology conditions will come from Chapter 7, and then for dermatology 12. For GYN, OB, that could be all over the place, but mostly 14, 15, and 16. Ophthalmology highlights, they have moved, which I'm glad to see. Bilateral codes have been added to include separate codes for specific eyes. That makes good sense. We already talked about diabetes and how it has changed to include underlying conditions of drug or chemical induced diabetes type 1, diabetes type 2, and now you see the addition of laterality when codes are related to diabetes with retinopathies, with or without macular conditions. Retinal occlusions and macular degeneration. These codes of primary open-angle glaucoma are now identified by the stage of severity and laterality. I do want to tell my team this is a very difficult section as well, ophthalmology. So if you all want some more information, I have it ready for you. I did not want to bring it in here and pass out here, but I do have it available to you, and plus you can get this presentation at any point. So for ophthalmology, age-related macular degeneration, the changes to 6 digit shows the laterality now, and the 7th is the stage. We have non-exudative, and then we see the early stage, intermediate, advanced, with or without atrophic, and advanced stages as well with. Exudative, wet. We see the different, if active choroidal neovascularization, we have codes for that. And if it's inactive, we have codes for those as well. The most important thing is that there are lateralities and there are stages. So our providers, we will be talking to them because we need to make sure that they include this in their documentation. Diabetes, we already mentioned to this that there is, for type 1, add the laterality. The last digit, which is the 7th digit, would be 1 for right, 2 for left, and of course 3 bilateral. We have to think of the type. Is it retinopathy, severity, or edema? So there are code sets for no retinopathy. And then there's yes retinopathy with proliferative. And then there's yes retinopathy with proliferative as well. So some of those can be coded with, they are coded with macular edema or without macular edema. And then some of those are based off of the stage, mild, moderate, or severe. Diabetes type 2, we added the laterality. So once again, we're just thinking, what type of is it? Retinopathy, no. I have a chart that's going to tell you no what to do or yes what to do if it has or have not retinopathy. If it has retinopathy but it's proliferative, there is a chart that tells you what to do if it's stable and if it's involving the macular. Moving on to vein occlusions.
changes is the 6th digit, which is laterality. The 7th digit is the stage. So we have central retinal vein occlusion with macular edema. Branch retinal vein occlusion with macular edema or stable. Then we get to the cornea. So for the cornea, most of the unspecified codes were eliminated, which is good. But there were added codes for single codes. We have single codes that's added now. I've listed those. Be careful of that, because some single codes, before they may have taken 2 codes, but now they've just broken it down to more specific codes. Foreign body injury and lacerations, there are no unspecified codes. The 7th digit is added to identify which encounter it is. The initial encounter, subsequent, or sequela. So as you see, we really, really have to stress to our providers to include this in their documentation. For herpes zoster and herpes simplex, there's no unspecified anymore. They will spell it out for you and tell you. I mean, it would have been very, very good to have had the new books right now, but we don't have them. So I had to keep going back and forth to the old book just to see, what the real difference was in reading it. But as I've stated before, if you have any questions about anything, you can always come to the coding educator and we can find the information for you. Then we move into a glaucoma. Most of the unspecified codes were eliminated there. Now they have staging codes, and what the note is saying is that if code includes eye indicator, then stage each eye. If no eye indicator, that's hard to say, code for the stage of the most severely affected eye. And I forgot to tell my coders to bring their books because I wanted you can get back, you can look this code up, H40.10X2, and it will give you a perfect example, because what they're telling you is that if it's not a stage, then they want you to stage the most severe eye, because it doesn't give us any laterality in some of the codes, okay, for glaucoma. Neuro-ophthalmology, no unspecified codes and no bilateral codes. And these are some examples of the conditions that we see with neuro-ophthalmology. We have oculofacial. Most of those unspecified codes were eliminated too. And the retina, most of those were eliminated, unspecified. That goes into the diabetes, type 1 and 2, degeneration of macula and posterior pole, and so forth. Any questions on that? Pediatrics, these are what we have now. And most of those codes were unspecified. I think we've been doing pretty good by not listing unspecified. Is that true, Karen? It's gotten better? Okay. We do. Yeah. We see pediatric patients. Yeah, we do. Okay, so now I'm moving into the GYNOB. And we do have a lot of updates there as well. Updates to the 2017 ICD10 GYN codes include more detailed codes, laterality, revision of post-procedural codes. So you're going to see some of the same things that Jenna was saying, like what happens after surgery. If this is a hemorrhage, hematoma what? And then it also deals with transplants. So we've added disorders of the breast. Okay. Disorders of the ovaries and fallopian tubes have gotten more detailed. They do tell laterality, but it gets more specific. They want to know, once you get down to the ovaries, is it acquired? Is it acquired to the ovary, and the laterality and the type is mentioned as well. Female genital prolapse indicate first, second, or third degree prolapse, specify the type and laterality. So you have prolapse and hernia of the ovary now. Prolapse and hernia of the hernia and fallopian tubes of the ovary. That should be ovary and fallopian tube. Torsion of ovary and ovarian pedicle. So then we move down to hypertrophy of the vulva. The type, unspecified. So there are some cases when we do have unspecified. Painful menstruation has broken down to the types now: superficial, deep, or other. So we have to get our providers used to this. Superficial, deep, or other. That sounds kind of strange, doesn't it? But maybe not. When you look it up, believe me, I looked it up to figure out what they were talking about because I was concerned. But superficial, and we'll talk about that later. I don't want to say it now. I'm too embarrassed. We have a few,
You didn't bring pictures.
I know, it has men in the room. I just don't want to talk about it. I mean, even though we're all, but one, it has to do with intercourse. Like, upon entering or once you're having intercourse, deep embedded. Okay. You said what? Moving right along. So for pregnancy and obstetrics, it's gotten a little bit deeper too with the abdominal pregnancy, tubal pregnancy, ovarian pregnancy, ectopic. It wants to know more, us to give more information. Whether or not a person is pre-eclampsia, and now there's more severe pre-eclampsia complicating childbirth. There are also other congenital malformations of female genitalia. So they go through those steps. There are more encounters for contraceptive management. Other status, encounters of procreation management and counseling for gestational carrier. Maternal care and delivery, supervision of pregnancy, history of molar pregnancy, first to third trimester. So these are things that we're breaking down to now. We have to be really, really careful and just really work well and communicate to our providers. You all communicate to me as we're going through this, and we'll take the message to the providers on what we need to really pay attention to. As you can see, the preeclampsia complicating periferia, I can't ever pronounce that word, afterwards, okay? Gestational diabetes controlled by oral hypoglycemic drugs in pregnancy, in childbirth, and after. Maternal care for disproportion due to fetal deformities. So they're having you to list the fetus as well. This is a lot that we have done. What they did add on there too was the low-lying placenta without hemorrhage, with hemorrhage, and then the third-degree perineal laceration. Post-procedural complications. We did mention that before, that if you have a hemorrhage, hematoma, or seroma, all those have been broken down so that they could be listed as post afterwards. We also have complications listed for implants, and we know, we hear it on the news all the time, somebody's saying, if you've been done by, call this attorney. So, so we have mesh implants, okay, listed now too. We also included disorders of the newborn. Okay, and the very last one that I'm going to talk about is dermatology. And believe me, dermatology had only a few. Cellulitis and acute lymphangitis of the face and neck, periorbital cellulitis was added. other disorders of the skin, excessive and redundant skin. And then we got into the same thing again about the post-procedural hematoma, hemorrhage, and seroma. I do want to say to my heme-onc and red-onc, we will be revisiting our providers, and mostly in heme-onc especially, is they need to be specific about what the diagnosis is. We need specificity, period, regardless if it's with the old 10 or the new 10. That's it. Any questions for me? Right. Both of them. Both Medicaid and Medicare. Medicaid's been unsettled.
Medicaid's been denying.
Yeah, Medicaid has been denying those. Medicare. We don't supposed to. But Medicaid it's been that way. Medicare is the only one that gave us a little grace period to October 1st this year.
And there are still
A few, yeah.
where you can use an unspecified, like with some of the upper respiratory conditions, unless you're going to do a culture, you wouldn't know what the organism is, and they
Right.
routinely do cultures. So it would be unspecified.
Okay. Okay. Thank you. I think it's you, isn't it? Okay, now here's the case.
Well, everybody already discussed all of my changes, so I could probably just go home. And I didn't do fancy PowerPoints and all that. This mouse is terrible.
Yeah. It's almost easier to use the thing that shows up and down on the side. Yeah, that's better.
All right, so these right here. Oh. All right, starting with diabetes, it's the same thing that ophthalmology said and all the other areas. The main thing is with the retinopathy, they've added laterality. And also long-term use of hypoglycemic drugs and prediabetes as a separate code. So make sure that if patients are using long-term oral drugs, such as the metformin and that kind of stuff, you need to list that. And that's one thing that the docs don't typically do, except maybe in medicine because they're managing so many medications. But there are a lot of long-term use of drugs, like steroids and anticoagulants, that kind of stuff. Lipid disorders, hypercholesterolemia is unspecified or familiar. And then, like Donine said, with the erectile dysfunction, they've added the, following whatever kind of therapy they had for prostate cancer. Excuse me, also the elevated PSA and rising PSA. We didn't have that before. And that's to help them. A lot of times with prostate cancer, they do surveillance rather than going right into surgery. So if they're doing the surveillance and the PSA rises, you can use this diagnosis for that. And then urinary tract, we see a lot of the urinary tract infections. And it's whether they have hematuria or it's asymptomatic or other microscopic chronic bladder, or other microscopic, chronic bladder pain and abnormal findings on microbiological exam of urine. And then like we said with the hypertension, they've added the urgency, emergency, and crisis. And then they've added 3 syndromes here, periodic fever and the cryopyrin-associated periodic syndrome and other anti-inflammatory syndromes. So we don't see a whole lot of that, but apparently they're monitoring it. And that's it.
What are you doing?
Yeah, we're all tripping all over each other because we're so interconnected.
All these things overlap.
It's still saying. This is my section, pathology lab, and pretty much all of it's been covered. So as you can see.
So we can go now.
Yeah, pretty much. They added a 5th character to the hypocholesterolemia so that they could add a code for the familial. They do have a code now for diabetes. They added a 5th character to abnormal findings of biological urine testing so that they could add a code for bacteriuria. And then for the PSA that, as Babs was discussing, they added a code to elevated PSA for rising PSA following treatment for malignant neoplasm myopathy. And that is it. So it all sounds really horrible, but most of the time, if you just try to work with your providers to give you the detail, laterality and post-procedural hemorrhage versus hematomas, you got it.
Well, the other thing that I wanted to say is make sure you remind your providers to update their problem lists, because we see a lot of conflicting information in those problem lists. So with the more detailed codes, they need to update.
So we have one last thing. So all of the codes that we talked about are available via Supercoder. Did you guys know that? Supercoder has access to all the updates. So do you guys know how to get to that on Supercoder, or you would like to see it?
I'd love to see it.
Okay. So Amici is our new coding educator. So he started officially today with us. So welcome, Amici.
You notice how they throw him right in?
So he's going to walk you guys through how to access all the 2016 changes to ICD-10.
Lisa, thank you. Okay. I continue to maintain one thing each time I get to talk. I don't know how to speak. I don't know how to write. I just know how to give you exactly what you want. And that's why we are here. Some of the time, like my colleague, they've given you a lot. I can't give you anything because all they have me to do here is supercoder. And I will exactly how you get new codes. Unfortunately, the book is there. Whether you like it or not, it's going to be in the book. Come October 1st, you have 2017. You got to use it. What we're showing you here is the new codes, the deleted and the revised codes. You can't do so much. With supercoder, all you get there to do is LCD, NCD, because you need to know the code to use. That is what I use supercoder for. I don't use it to look for codes, except in CPT, where I have to look at what was done. Apart from it, when you get to ICD-10, please go through the book, because that's the difference. If you go here, you might get an error. But if you go through your book is what is meant for your coding. So when you see some of these things you see in the system, we have errors too, because all the time you can have some of them. I got into even the ICD-10 itself. Sometimes you start looking for a code and it is endless. Endless
in the sense that you pick up something else. I've seen something like fungi sinusitis being B49. I don't know for what reason. I know it is fungi, but how about the sinusitis? If you go there, it takes you to rhinitis. If you get to rhinitis, you go nowhere anymore. But the code is B49. Why? It is from code books. So I believe that we will go through all this. Here, anytime you come, you want to look for your new code, what are we looking at? It is ICD10. If you go to CPT, you will see nothing now. But if you come to ICD10, you click, go down, then you see the new, that's it, you click on it. Here you find all the new codes. This is, when you're looking at the codes, you will find out that here is the highest. We have about 2,700 new codes, about that. Musculoskeletal took almost 600 and something out to the code, so the rest is shared. So what does it mean? You have to be careful not to break your legs. You have to be careful not, because most of them are associated with pain or one thing or the other. You know, entire body, when it comes to body formation and the frame that will hold, is all about musculoskeletal. So when you have issues, it's going to affect almost every part of the body. So that's why we have so much code. And again, 2017 will be a little bit more difficult in our coding for Medicare and Medicaid. Medicaid has already started refusing to take unspecified codes. So most of the time I see them in tests, and I know they can beat me on unspecified, but they cannot beat me with other specified. So I go into the, you go into the book, you look at what the physician said. There must be something qualifying what you're going to pick. Then it becomes other specified. Because if we stay by what the physician says, especially we who are in coding CPTs, if we pick on CPT code, you look at it and it says, I can't take an unspecified code. But meanwhile, if you go to the HRP, you find out that it was qualified either in the indication or wherever. You pick an other specified, and Medicaid will take it. Those are the things we'll be running with this time. But you know, if they give you a grace of 1 year, after that, they might even reject other specified. So each time you see all this, make sure you ask your physician. Try and get back with them and say, I'm looking at this code, it will not go through because it's under unspecified. Is there anything that you, before you finish, they must give you something to go with. So I think, so if you go here, go to musculoskeletal, you will see. What tells you that you have something voluminous to do? Look at how little that is. If I start moving down, we will not end. We'll keep going. So I want you to know this. So most of these codes are, I think these diseases are there. They were there before ICD-10 came up. But as time goes on, usually 5 years before ICD-10, the most we can do in ICD-9 was 200. But look at the first one, we're going about 20 times. That will tell you what is going on. That means we're expanding more than ever. And that does not mean that next year we might not get things more than this. So watch out. But one thing that you'll be taking from it, each of these, you'll find out, I think what I found out is when she came, I saw how small it is. And the same thing with psych. I will be in this area, so I was happy when I saw it was so small. Okay, so this is how to check. So if you go down, you find out, then they give you the description. You see there, deleted. Some of them are already deleted. Now, the question is, why will you delete what you just put last year? That's about, we are just 2 years in ICD-10. Now we are deleting and adding. So it means that some of them that were unspecified now have specificity, so they have to delete the unspecified codes. So you'll be seeing them, you have to check, you have the revised code, you have the deleted codes. This is how you find them. Well, that's all they say I should tell you. think
And we'll send you guys instructions on how to get to this. We also have a crosswalk with Excel projects. We have broken down by special needs. We have that too. But we just wanted to make sure we show you guys that information is out there currently for you to access, even though you don't have it. So we'll have another session next week, tomorrow, so that becomes another one. But there are the sign-in sheet is in the back, so please make sure you sign in, and we'll send everything via electronic. Thank you, guys.
Send this out today, are you?
no.
Okay, because I see, I've got one bullet wrong on one of mine, so.